studies from 3 of our local teams from 2:25 till 2:55, and then we've got a little bit of time, about 15 minutes, for some questions and answer sessions with all the speakers that have already spoken. I mean, you can read this for yourselves, can't you? But just to explain what will happen after that, we're going to be allocated to breakout rooms, and each of the teams will lead a discussion to consult around their plans and how they can develop their community strategies and well, we've left it to them to shape that, but around what their community involvement might look like and how that might be shaped, so that will be led by the people from the foundations themselves. Then we'll have a quick break to get a cup of tea or whatever, and then we'll go back. So if you could stay in those breakout rooms and just switch videos and sound off when you go for your tea break. And then when we come back from that, we'll go back into those groups and we'll do some, the hope is that we can talk about what the possibilities are for research collaborations in the future that might come out of the people that are at the workshop today. So things that we might be able to take forward in terms of research in this area in the future. And then we'll come back all together as one big group for the last 15 minutes or so for some feedback and to summarise what we've done during the afternoon. So shall I carry on, Emma? I can see Emma's joined again, but I'm not sure if she's able to actually speak. So I'll continue for now unless someone shouts at me to do otherwise. So the rules, which I suspect everyone's familiar with now, but do try to keep your microphone muted unless you're actually speaking, just to keep the sound quality better and prevent too much feedback. Stop your video to help with the streaming quality if that's okay. It says start it during the social, but I think we mean during the Q&A session. If you want to speak, do put on your video and speak at that point. You're welcome to type questions into the chat function throughout the session, and we'll put those to the speakers during the Q&A session. Again, I don't think we are planning to have the social as such today. We've had that on previous events where we've had a chance for a bit of a chat, but we might have some time at the end when we're doing the feedback, maybe where we could have a bit more of interaction there. We expect professional conduct, of course, and I'm sure that's not going to be an issue. And if you feel someone's behaving inappropriately, it's me apparently who's the bouncer today. So do let me know if you have any concerns. So just a slide explaining what FUSE is. I suspect a lot of people here are familiar with this, but for those of you who don't, we're part of the School for Public Health Research, a virtual centre across all of the 5 Northeast universities. And really what we want to do is work very much in partnership with practitioners and policymakers to make sure that research findings are translated into practice and that the research we're doing is appropriate and around important public health issues. So the FUSE physical activity, we've existed for over 10 years, I'm just seeing, since 2010. And our aims are to build physical activity research capacity across the region and more widely, and particularly over the last year, we've really expanded to, I think we've had a speaker from Australia at one of our meetings, so there are advantages to lockdown. We want to share knowledge and provide networking opportunities for policymakers, practitioners and academics in the field of physical activity, and support implementation of physical activity strategies. And you can find out more about us on the FUSE website under the physical activity workshops part on the website there. Okay, so I'll say some thank yous just before we start. So to our speakers from the foundations, Liz Barton-Jones, John Fothergill and Ashley Lowe, and Michael, Salla, Andy Smith and Paul South. To the FUSE team who put in a lot of work to make these events happen. So that's Cheryl, Mark and Laura. And then my colleagues in the physical activity working group, I won't read out all those names, you can see them there. And then to you, thank you very much for attending and for making the workshops go well. So I think now, without further ado, I'm going to hand over to our first speaker. So I think that's Andy, is that you? Are you ready to share your screen? I'll just stop sharing mine. And is it Michael? Are you going first, Michael?
Thank you, Louise. I'll just wait for the screen to show up and I'll make a start. But yeah, firstly, thank you to Louise and thank you to everyone involved with FUSE for giving us the opportunity to speak to you all today. It'll be myself, Mike Salla from Everton in the community, and also Andy Smith from Jill University. And I'll kick things off the first part and then hand over to Andy for the second part before we open up to any questions afterwards. So just in terms of Everton in the community, just to set the scene, if you like, we are the official charity of Everton Football Club. We were established in 1988. So it's more than 3 decades now that we've been delivering a range of programmes in the local community to help support with regards to identifying and addressing various social need. In 2013, we developed our academic partnership with EdGil. And it's quite a unique partnership in the sense that it's such a long-standing partnership. For more than 8 years, we've now worked together and we've had a lot of success with regards to helping to secure new funding, helping to co-design and co-deliver projects, and ultimately helping to really increase the evidence available in terms of the impact that we're making. So we'll talk you through this today in a bit more further detail. The next slide just talks you through the most relevant programme in terms of today's focus. It's our health and wellbeing programme, and it's always had a strong focus on tackling health inequalities and providing the provision where the need is greatest. We do this across a life course provision, and I'll come on to that in a moment. And we have 3 main categories that we focus on in the main part, which are long-term health conditions, mental health conditions, and also age-related conditions. The next slide just shows us our life course provision. So as we can see here, literally from conception age with our Everton Dads project support, and from conception up to 2 years of age, right the way up to the Stand Together, where we support older adults, with our current oldest participant who is 104 years of age. So it's quite an extensive continuum, to say the least. And it's important to have this life course approach so we can identify various population groups who are at risk of poorer health outcomes, and also to help make sure that we are supporting with the whole health inequalities agenda. What we're also able to do with the life course approach is to identify key transition points, whether that be going from primary school into secondary school, whether that's going from employment into retirement. We know there are key transition points where the risk increases of poor physical health, poor mental health, and a combination of the two. The next slide just shows us a pathway that we operate with regards to our health and wellbeing programme. So essentially at the top, people can engage via self-referral or via a referral from their GP or from a different organisation or charity. And essentially people who are at risk of or experiencing poor either physical health, mental health, as I mentioned, normally it's a combination. They will enter into our triage support system, which is managed by Everton in the community practitioners. And ultimately their aim is to identify an individual's needs and interests and desires, to then make sure we can best support them in different ways. We do have an additional layer of support from professionals. So for example, our Everton in the community GP, access to health trainers. And the idea of this extra layer of professional support is to provide clinical support, but importantly in a community setting, whereby we know this approach is more beneficial in terms of engagement, retention, and also behaviour change. Following this triage support system, individuals can then enter into one of our projects which fall into these 3 different areas with children, adults, older adults, which align to the wider policy areas of starting well, living well, and ageing well. Individuals can stay involved with these projects for as long as they feel that it's of benefits. And we have a number of people who've been involved for a number of years, some more than 10 years. A number of these individuals then become volunteers and also staff members. And it's great to have them on board in terms of providing that lived experience insight to help inform future practice and help improve project delivery. Ultimately, the aim at the bottom here is to improve health outcomes, to improve quality of life, and also alongside this to help tackle health inequalities. The next slide. This just gives us an example of one of the projects that we deliver in partnership with EdGil. So it's Tackling the Blues. It's a project to support children and young people who have been identified with poor mental health or at risk of developing poor mental health. It works with those aged between 6 and 16. And again, because of the benefits of the partnership with EdGil, we can see here real evidence. So this is a journal article that was published earlier this year, which documents the impact of the project, why it's been so successful. It's engaged over 1,000 children and young people, and there's been some significant improvements in a range of areas, whether that be around mental health awareness, mental health literacy, emotional literacy, and also educational attainment. On the right side of this slide, you can see a couple of word clouds where this has been provided by pupils, teachers, and also parents about where a lot of the improvements have been taking place. The next slide shows another example of our military veterans project called Everton Veterans Hub. And this is another project in partnership with Jill. Recently produced a evaluation towards the back end of last year, which is available to all of our listeners today, which helped to document again the impact of the project and understanding the reasons why people engage in this, why they don't engage with other services, for example, why they've stayed involved, and also what's helped them in terms of the project to help with behaviour change and improving their life in different ways. There are a number of case studies within this evaluation as well as a couple on the screen here, which talk about how a couple of people were involved with really poor levels of self-worth, addiction, suicidal ideation, and as a result of the project, they'll be able to become a lot more independent. It's given them a focus and something to really develop their career prospects in different ways as well, with regards to help and support with training, education, employment. At this stage, I'll hand over to Andy, who will delve into this work in a bit more detail. Over to you, Andy.
Thanks, Mike. I'll just start my video and then we'll kick straight on. Yeah, as Mike mentioned right at the beginning of the presentation, the partnership between the university and the charity is now well established, and I think during the course of the last 8 years, we've tried to develop very much a research policy and practice partnership, which encompasses a range of different stakeholders within the university, but also within the charity and the wider football club. And we were asked really to talk very briefly today around the approaches that we've taken to establishing the partnership, and then how that has translated into various research outcomes and particularly funding opportunities and funding streams. I think in general terms, the kind of work that we do can be broadly divided into three key areas. We have education, and one of the key things that I'm sure many people on the call will be familiar with is really the sustainability and the capacity in the system to sustain the types of activities that are currently being delivered in this space. Kind of across the health and wellbeing sector of Everton alone, there's over 20-30 programs, and to help sustain meaningful impacts which achieves the outcomes that we set ourselves, it's important that we have a workforce. So some of that workforce is recruited from ourselves. We will recruit trained student mentors in the field of health and wellbeing at both undergraduate level, but also through our postgraduate programme, which focuses very much on sport, physical activity, and mental health. And what we have tried to do over the course of the last 8 years or so is to develop a peer mentoring system between students who are undertaking PhD or postgraduate research, who then work with our undergraduate students to help deliver some of the programs that Everton will provide. And in other cases, it's through volunteering or other accredited placement opportunities that students can interface with this work. To give a sense of the size of scale of this, it is obviously quite a significant undertaking. At present, we have around 50-55 students who are working with us internally on Everton projects alone. We also work across other sports with Everton, including rugby league, on a programme that colleagues may be familiar with called Offload, which is a suicide prevention programme in men, and we're trying to share some of the learning around programme design, effectiveness and outcomes on that that programme, and to feed that back very much into research. So our kind of role in the research context is really to work with Mike and his staff to identify opportunities to develop joint research projects. So at the heart of this is very much the academic staff working with the charity staff and other stakeholders to identify core priorities for the region and the area, particularly across Liverpool City region, which I'm sure, like many areas in the northeast, has been significantly impacted, of course, by COVID, but in many respects, COVID has shone a light on what was already significant health inequalities being experienced unequally across the region, and some of the work going forward that we're currently planning and already beginning to develop is really on tackling those wider health inequalities that affect both physical and mental health, and to develop insight for the charity and for colleagues who are working on programs to ensure that they're responding to local need by working with some of our community stakeholders and program users. We have impact analysis and other work that goes on with local community groups to identify their priorities for the region and how we can work with them in designing key research questions, as well as developing funding applications, which I'll come on to on the next slide. But I think a key part of that is not just the university clearly benefiting from student development and its academic staff benefiting from research output, but also impact development. It's about really us giving back to the charity and to supporting the training and personal development of staff within the charity. So all of the work that we do is reinvested into the partnership. So all of the benefit from funding and so on is reinvested into activity. And some of that is really allocated to training. So we will provide training for our academic staff as well as delivery teams, both in the charity and in the university, around mental health, around suicide prevention and intervention. Annually, we host our own health and wellbeing conference where students and other members of the university environment, including our researchers, interact with the charity and its key stakeholders to share learning on the previous year's activity, and to share best practice, but also to identify opportunities for developing new programs and new research ideas. I think at the moment, some of those research ideas and the focus of the translation of evidence into practice is really focusing on three key areas, which I think the King's Fund and others have identified as being particularly critical, and especially post-COVID, and that is around neighbourhood, place-based approaches and learning, and system approaches to health and well-being, particularly at the local level, but also in our case across the city region level as well, and how that interfaces with kind of the emerging policy and practice priorities of the local councils, as well as the other CCGs and so on. And I think this will be critical going forward, particularly in light of the development of integrated care systems, which is clearly going to be important for us in developing some of these core areas of activity and work. We were asked to kind of talk very briefly around some of the potential funding streams and successes, and I think one of the things that we've benefited from developing our partnership, I guess, is to identify different types of funding streams, but also opportunities to share evidence and insight, not just between ourselves, but with other stakeholders. And some of those organisations from whom we've received funding or have clearly applied for funding for are really represented on the screens in front of you. And I think from a university perspective, it's enabled us to tap into some of the UK research institute opportunities that are available, and the various research council activities and grants. From an Everton perspective, given their constitution, we're able to engage in other charitable funds or other funding opportunities that typically wouldn't have been available to us as universities. So we have generally tried to work through a strategic approach really to identifying funding and from different work streams that are accessible either solely by each of the organisations or jointly and in partnership with other organisations. I'm sure this is an approach that many colleagues on the call have taken themselves. So nothing particularly new here, but I think one of the benefits that we found in identifying the relevant funding streams and being successful with those is really having quite a strong local network of stakeholders who are in clinical settings, but also in local neighbourhood settings and local organisations where we do have variations on PPI essentially to help evidence the need for what it is we're trying to propose and to leverage some of the local community assets to address some of the major challenges that are being experienced in the city region, and they're typically some of the major physical health problems with which we face currently. That will include diabetes as well as cancer, and in relation to mental health in particular, that is becoming an especially significant challenge. It was pre-COVID, it's become majorly problematic, and to work across the different sectors in place-based approaches to community care is really the kind of the direction of travel, I think, particularly as we try to leverage some of the additional benefits of working in this space. And in terms of developing the capacity, I've spoken previously around developing spaces and opportunities for academic colleagues to learn from and to work with colleagues, not just at the football club, but with other stakeholders at the clubs, and to work regularly with the local community networks that are the intended beneficiaries of much of this work. And at the beginning of those activities, one of the things that we try to do is to agree the use of the research. How is the research to be used, for which beneficiaries, and for what purpose essentially, and how do we support that in terms of the delivery of programs? So some of the funding that we'll look at is deliberately about capacity building, ideally in the longer term, so not just on fixed term yearly contracts, but ideally over the course of 3 to 4, possibly even 5 years. And some of that is through PhD research and joint funded PhD research. Others have been through bursaries, which are provided to postgraduate students that we manage as academic staff, and we mentor the students alongside colleagues in the charity. So students will benefit themselves by working alongside research users or delivery teams, and to get a sense of the kind of the local priorities that are intended to be addressed in this particular setting. What is critical, I think, is that we do continue to enjoy senior leadership and decision-making support from both organisations for various reasons. Some of those are particular, of course, to HE, others for the football charity sector more generally. But it is a joint venture in terms of workforce development, and to build in the expertise around the use of evidence and monitoring and evaluation on the ground, and to agree the key parameters of the respective parties' roles, really, which I think is really key to achieving the kind of research outcomes alongside the charitable outcomes and the other priorities of Everton. What's also key, I think, is right at the beginning, we do agree also the dissemination strategies. So we deliberately try to build in opportunities for research dissemination, not just in the traditional academic sense of journal articles and impact reports and so on, but actually to feed that back into the local community networks and groups who were the intended beneficiaries of the programme, and to share that with our public engagement channels and teams. I think that's really, really important for us, that we actually feed that back into the local level, and to get those community groups and others to comment on the work that we're doing, with a view to supporting and informing the research which is ultimately produced from this. So that's very much a whistle-stop tour of what we do. We have, as Mike said, spent a number of years developing the kind of capacity on this. So in terms of staff from the university, and we will have upwards of around a dozen academics who will work with us on this particular approach to deliver. And it's very much a partnership which colleagues contribute to different elements or strands of work on, and then they're in regular contact with colleagues at the charity, and ultimately that kind of regular engagement and contact is critical, I think, for identifying the priorities, but also pursuing new funding opportunities. And over the course of the last cycle of research, we've been successful in generating just over £1 million worth of funding for this type of work that has supported the development, really, not only of the partnership, but the long-term community networks that we have in place, not just in the immediate surrounds of the charity or its football ground, but actually more widely across the city region. I'm sure there'll be questions on that as we go through, but my and Mike's emails are at the bottom of this screen. So if colleagues did want to touch base after this event, then we would be more than happy to talk with you and to share ideas and best practice, and of course to collaborate. And I think certainly going forward, collaboration on joint projects is key for us as we begin to respond to the physical and mental health challenges that have been presented by COVID. So I think I'll end there. I know that there will be time for questions throughout the day, but just again to reiterate Mike's thanks to colleagues for the invite today. We've tried to keep it quite high level rather than into all of the minutiae. Some of that has been published, and we're happy to go into that further. So thanks again for listening, and we really look forward to learning from other colleagues who are on the call today from what is clearly a really exciting agenda. Thanks very much.
Thanks, Andy, and thanks, Michael. So I have recovered from technical difficulties, so just rewind very quickly to say hello to everybody and introduce myself. So I'm Emma Stevenson. I'm Deputy Dean of Population Health Sciences Institute at Newcastle University, and I'm delighted to be part of this today. We've had a fantastic relationship with Newcastle United Foundation over the last few years, and share a lot of Andy's sentiments about the fantastic benefits of that collaborative approach working with the foundation and the university. So we are going to go straight on to our next section, and we've got time for questions after that. So if you've got questions for Andy or Michael, then please do pop them in the chat, and Ollie, Bell and I will try and manage questions. But we're going to go on to our local case studies now. So our first speaker is Liz Barton-Jones from the Foundation of Light. So Liz is going to talk about some of the work that they've been doing. So over to you, Liz.
Thank you, Emma, and thank you, Michael and Andy. That's a hard act to follow, but I'll do my best to share. I've dodged webinars for the best part of 18 months, and in the last week I've done 2. I made a commitment last week that I would do something every day that sort of supported 5 ways to well-being. And today's is obviously this as a connect, but also be active given the rate that my heart rate's going at the moment. So please bear with me, completely outside of comfort zones, and I'll do my best to share some of the work that we're doing at the foundation. So similar to what colleagues have already said, we are we're the official charity of Sunderland Football Club. We use the power of football and the SAFC brand to improve the lives of our communities, and our geographical area is Sunderland, South Tyneside and County Durham. We're based at the Beacon of Light, which is this fantastic building in the image here. We fundraised completely to build this building, and we've been now in this building for kind of just close to 3 years, obviously the last year being the most challenging. We work with during the time we turned 20 this year, So we've worked with over 500,000 people of all ages, all walks of life, and we deliver through 4 main programme areas: education, world of work, sport and play, and health and wellbeing. And I'm the head of sport and wellbeing. Just wanted to kind of put some of the work that I've been working on and where the health strategy has come from in context, really. We've recently developed an impact-driven strategy, our hat-trick of strategic aims. And we've very much sort of been using the opportunity that COVID's presented to really look very sort of local as to what the needs are, and picking up on, you know, what Andy said in terms of place-based approaches. This strategy really looks at that. Our vision is better opportunities, better lives. Our purpose to involve, educate and inspire our communities using the power of football and the brand, as I've already said. So just wanted to share with you the actual aims, because I think it's important to have that context. So we're very much saying that we want to make every contact count with 3 million hours of meaningful, tangible engagement. So this is very much less around mass participation, which I think is probably the direction of travel that we've been on previously, but much more about those real meaningful engagements, actually really making a difference and demonstrating that we're making a difference to people's lives, whether that's better life chances, improved mental health, or generally reducing inequalities. That's kind of where we're looking at for aim 1. Aim 2, to create and continue to create a vibrant and sustainable beacon of light. As I've said, you know, COVID hit the building sort of really quite challenging. We were up to 7,000 visitors a week coming into the centre. That number needs building back up as we come out of lockdown. So the need to demonstrate that the building and the beacon is a place for everyone, a community hub, which brings the foundation's programmes to life, but is also used as a community hub for local people, local sports organisations. We want to make the building so that we create a sustainable surplus, because anything that is generated as a profit is put back into the charity. So it's really important. That gives us an opportunity to be less reliant on funding from some of our more traditional partners. We want a beacon for everyone and better informed decisions. So really connecting with those customers and providing an offer that they want. The third aim is about being the best in our field, and I'm sure my colleagues from the other football foundations will have that same aim and ambition. If we achieve aim 1 and 2, it'll put us on a really strong path to being you know, one of the best football foundations in the world. We need to make sure that we've got real good governance, employee and customer satisfaction, and raising funds, as I said, to put destiny in our own hands. But we need to be really people-centred and really get that engagement. We need to be learning, and we need to be innovative, and we need to be reliable and trustworthy. So just wanted to put those aims out there in terms of supporting the health and wellbeing strategy. This is just taken from our yearbook, which at one point in the year we thought would be a bit plain. But given the opportunities that COVID presented, particularly to the health and wellbeing department, we've been able to turn things significantly around some of the programmes that we've been involved in. We secured Get Out, Get Active funding through the Activity Alliance to have a more inclusive approach towards physical activity. And we're the only football foundation in the country to be the lead partners. So it's a real sort of trailblazer for other foundations to be involved if we get this right, which we are doing at the moment. We've been involved in Extra Time Hubs, which is the start of a national social movement for people in their retirement years, for them to meet once a week and do things they enjoy. Again, harnessing the power of the football club in the local community to bring those people together to combat loneliness and inactivity. And our programme's actually going to be growing over the next couple of months, thanks to more investment from Sport England and the EFL Trust. We also run, and I know colleagues from Middlesbrough are talking about this shortly, but the Man versus Fat Football, Man versus Fat Football and Fit Black Cats are part of our weight loss programme. So we're connecting to those. And we're a partner of the Be a Game Changer programme, which I know Ashley is going to talk about more in detail. We've been commissioned by the North East and North Cumbria Suicide Prevention Network to work with the foundation and to deliver the programme in South Tyneside and Sunderland. So there's lots of opportunities in terms of what we're delivering across the foundation. In terms of our strategy, these are some recent documents. At the top are recent documents that have come out from Sunderland. And again, I think there's probably documents like this across each area at the moment. But we've tried to, we're trying to consider the implementation and the plans for the city plan in our document. And our document very much is Sunderland based at this point in time. We felt that one size didn't fit all in terms of a strategic document across Sunderland, South Tyneside and County Durham, given the different inequalities that exist in those areas. Some of the significant key health challenges in Sunderland are social determinants and poverty set a pattern of poor lifestyle behaviours that compound poor health, and this is taken directly from the Health City Plan. Preventative approaches to poor health and tackle the social determinants while supporting people to have positive behaviours. So they're, you know, some of the challenges. And again, I've put it up, but again, not new data to anyone working in Sunderland. And this was just taken from Fingertips Public Health England. You know, some of the challenges that people living in Sunderland face against national averages. So our document, we wrote it during lockdown, and this is probably the first occasion we've kind of shared it with anybody outside of our organisation. We're very much kind of at the consultation stage, and we're doing that as we go along. So what we're looking to do around these health inequalities, we want to work with local NHS partners, third sector organisations, universities, to really integrate health and wellbeing messages into all of our current and new Foundation of Light programmes. We want to innovate with new prevention-based programmes that engage new people into health and wellbeing activity. And we want to support people, particularly those in the deprived neighbourhoods, to overcome heightened inequalities caused by COVID-19. We're going to do that through our brand reach and our investments. So our brand reach, we know, very much using fandom, which is what a lot of the programmes can access and can demonstrate the impact on. Sorry, I'm conscious of time. I was supposed to have a minute, so I'll whiz through these. So our first priority is around tackling obesity, and we want to explore new ways to tackle obesity, support young people to make the best start in life, and adults to have access to physical activity in the community. So we want to do this through collaboration, prioritising the delivery of physical activity programmes to those people that are least active, and contribute to the kind of the wider programmes led by partners to promote active travel, for example. Picture 2, priority 2, better lifestyle choices. So again, we want to develop new projects that target young people who are at heightened risks of engaging with risky behaviours. So whether that's alcohol, smoking, substance misuse, embed physical activity or physical well-being and lifestyles into current and new programmes, and really making the best or the most opportunity from making every contact count. We want to capitalise on our relationship with local employers to support and deliver positive workplace, and support colleagues in the NHS on high profile campaigns. So how can we support them, not necessarily reinventing the wheel, but how can we support them with their campaigns? Priority 3 is around improved well-being, improved mental well-being. So we're already started this work through Be a Game Changer, but there's so much more to do. We want to work with partners to develop programmes to improve resilience in children and young people. And I'll certainly be contacting the guys at Everton to have a chat about some of those. That Tackling the Blues sounds a fantastic programme. We're going to create wellbeing hubs to again, be very specific to men. We want to make sure that we can scale up, but also explore how targeted activity can support improvements in mental health within targeted groups. And the last priority, or priority 4, is around real tackling that loneliness and isolation. And again, this was, you know, obviously from the back of COVID, but it's also been something that's been a challenge even before COVID to some of our population. So again, looking at how we can get innovative health and well-being opportunities, develop and implement a reminiscence project, expanding our extra time hubs, and embedding wellbeing into some of our employability and other programs that we run and deliver. In terms of evidence and our impact, again, you know, we know we need to be better at this. So it's something that's really strong in the strategy. We have started making steps on this. We have a PhD student that works with us, Andrew Bailey. I think he's on the call today. And he's looking specifically at one of our programs and taking a realist evaluation on that program. But we're also doing a lot of work around impact and how that fits, and not just saying we've had an impact, but being able to demonstrate that. Lastly, because I can see Emma's looking nervous because I'm ruining all the timescales now. It's just an opportunity to show some of the depth of where health and well-being is sitting. So it's not just around that physical activity kind of strand of it, but we're weaving it into, we've currently got a heritage bid where we're weaving 5 ways to well-being into the heritage bid. We're connecting with some of our other local providers as well, and I can provide those details if anyone should need them, but I'm conscious I've gone over by a couple of minutes, so my apologies, but thank you.
No problem, Liz, that was great, thank you very much. Some fantastic work happening there. So we'll go straight on to our second local case study, which is Paul South from Middlesbrough Football Club Foundation. So Liz, if you could just stop sharing your screen, and Paul then can share his. And just to remind people, if you do have questions, pop them in the chat, but obviously there will be opportunities in the breakout sessions as well to ask questions to our speakers. Paul, do we have you there? Can you hear us?
Yeah, I'm here. I just can't share my screen at the moment.
Oh, you've just been made co-host, so hopefully
Brilliant.
That should work now. Great. Okay, over to you, Paul.
Okay. Right. Good afternoon, everyone. First of all, I'd like to just echo Liz's words and say that this is completely out of my comfort zone as well. So I'll do my best to be as coherent as possible and as insightful as possible over the next few minutes. Just by way of introduction, my name is Paul South. I'm the health coordinator at Middlesbrough Football Club Foundation. We are the official charity of Middlesbrough Football Club, and we deliver in the area of Middlesbrough and then the wider Tees Valley area as well. We also have a significant new development in East Cleveland, where we try to transfer the things that we deliver in Middlesbrough to a wider field. Let's start my video as well. I'm going to talk specifically today about one of the projects that we deliver through health, and that is going to be our Fit Fans program. So just to give you a bit of an overview about that, it was launched in January in 2020. 30 clubs across England, including Sunderland, deliver the program, and it's supported by £2.25 million of lottery funding from Sport England, and aims to use the magnetism of football to tackle obesity levels in over 10,000 fans across the country. Now, just to break that down a little bit, 36.4 million people, which are around about 61% of the population, live within 10 miles of an EFL ground. with 4 in 10 residents within this catchment area falling the most deprived population groups. I'm going to look a little more into the local need with regards to Middlesbrough in a couple of slides. But originally Middlesbrough were delivering the original programme, which developed in Scotland. It was created by the University of Glasgow and the Scottish Professional Football League Trust. So we've been delivering a similar programme in a sort of slightly different guise for about 5 years now. I'm just going to tell you what the aims of that programme are. So basically we want participants to improve their eating habits by reducing portion sizes and like swapping fatty and sugary foods for fruit, vegetables and high fibre foods. We want participants to achieve at least 45 minutes of moderate intensity physical activity on most days of the week. From a practical sense, they receive weekly sessions at the football club for 12 weeks. And that is split between a 45-minute health workshop, followed by exercise at the stadium, which can take the form of various forms of exercise like boxercise, circuit lessons. It also uses the tried and tested behaviour change techniques to become more active and improve their diet. These include regular self-monitoring of weight, so that can be done on a weekly basis in the lessons, monitoring pedometer step counts, and also regular SMART goal setting to make sure that the changes can be sustained long term. So looking a little bit at the local need, Middlesbrough, the adult population generally has worse health or below average health than the rest of the country. There's just a few examples on the slide I'm showing you there. So the rate of alcohol-related harm, hospital stays is worse than the average in England. The rate of self-harm, hospital stays is worse than the average in England. And then there's a couple more, such as smoking is worse than the average in England, which unsurprisingly means the life expectancy of both men and women in England is lower than the average. Okay, so there's a real need for this type of program in the local area. And we hope to use the impact of the football club to capture people's imagination and inspire them to lead a healthier lifestyle. So, when we think, why would this be important for Middlesbrough Football Club to do? It offers people the opportunity to get a real behind-the-scenes look at their football club. They can get to exercise in an environment that is really comfortable to them and inspiring. They can get advice from coaches, including the chefs at the football club. So they get advice on food preparation. They get an insight into dietary requirements of the players and how that can be translated to their daily lifestyles. They get to have the unique opportunity to train at the Riverside Stadium. So I think on the slide there, you can see people taking part in their nutritional workshops in one of the stadium restaurants. And then in the bottom right-hand corner, there's also an example of a circuit class taking part in the concourse there. We also try and involve current and former players. We have a current ambassador. We have Neil Madison, who has made, well, pre-pandemic, made visits to the sessions to show support and act as an inspiration and motivation for the participants taking part. In the past as well, pre-pandemic, we've also arranged for participants to be transported to the training ground where they've had healthy meals prepared them by the club staff. Also previously, participants were offered as a reward tickets to games and other incentives. So it's really trying to use that power of the badge to get as many people inspired to lead a healthier lifestyle as possible. The only thing that I mentioned there is also we've got other coaches and other people come down to talk to the groups. In the top right-hand corner, you can see Stuart Hall, former world champion boxer, came through to speak about his motivation and dedication to leading a healthy lifestyle. And again, that's just another way of getting people to buy into the course and to get the most out of what they're doing. So getting people to buy into the course is one thing, and to enjoy training at the stadium. What we'd like to do though is to see those habits transformed into long-term sustainable lifetime and behavior changes. So it's good to get people to come to the stadium to train for 12 weeks, but what we really want is them to continue long-term, enjoying those benefits. So in order to do this, I'm just going to show you a slide there which shows the impact and how we sort of monitor and evaluate the sessions. So prior to the course starting, we get some baseline measurements. So we have height, weight, waist measurements, BMI, and blood pressure. In addition to that, each of the participants fill in a healthy lifestyle questionnaire, which covers eating habits, alcohol consumption, activity levels, and also well-being. These are then repeated again after 6 weeks and then 12 weeks. And then to ensure long-term sustainable changes, we also have a 6-month review and a 12-month review. An example of the questionnaire and the participant record is shown there. So obviously the questionnaire is 4 pages long, so I've just shown you the first page of that, in which you can look at the sort of questions that are asked in regards to dietary habits and eating habits on the first one. The participant record is where we put the initial measurements and then the measurements after 6 weeks and 12 weeks. Okay, and on the back of that, there is also a health questionnaire. As I say, we've been running the program for over 5 years now. So I've got a few stats on there which represent the cumulative figures for both weight loss and reduction in waist measurements. So these figures are based on an average of 9 pounds weight loss and also waist reduction of 5 centimeters. So over the past 5 years, we've delivered to roughly 750 people, a mixture of men and women, predominantly men, due to the way the funding was previous to the start of FitFans. So you can see there, we've got a weight reduction of cumulative weight reduction of 3,000 kilograms and 3,750 centimeters for the waist size. Participants completing the course have also reported significant decreases in blood pressure. In addition to that as well, participants have anecdotally reported to us a decrease in the number of times they visit the GP, and also improvements in their long-term health conditions, examples being arthritis, ME, and other muscular pains as well. So as I mentioned, the course is 12 weeks, but we'd like participants to sustain their behavior changes. So we're in the process of, now we're getting back into face-to-face delivery following the pandemic, trying to put in place a structure that will help people continue to exercise within the foundation. Examples of which are what we started now, fitness sessions at the Riverside Stadium. So we've got a drop-in every week. So participants who complete the 12-week program will be able to come in and take part in either structured exercise classes, or we're going to have, we're in the process of setting up like a sort of, I would describe it as a pop-up gym where people can come in and under supervision can use different pieces of equipment to have a workout. There are also additional health workshops that we're going to hold at the Riverside as supplemental sessions to the 12-week course. And then we're also looking at community-based football sessions and community-based fitness sessions, some of which we've got started again now. One thing that I have mentioned there as well is we've also got a successful fit walking program, sorry. So a couple of years ago, we developed a fit walking football program, which was for people who graduated from the initial 12-week course, and that is running now independently, known as Fit Walking Football Club, and we have up to 50 to 60 individuals take part. Or we did have, it's getting back up that way now, on a weekly basis at one of our outreach centres. We hope to do that again with some additional sort of circuit classes and box size classes based at our outreach centres as well. I'm going to finish off with a couple of case studies just to show you the effectiveness effectiveness of the programme. So the first one there, we've got a season ticket holder called Alan, who's 60. He suffered from chronic fatigue syndrome. So for 25 years, he did little or no physical activity. And upon a visit to the GP, I was told that his blood cholesterol readings were high. And unless he lost a bit of weight and became physically active, he was going to have to go on medication to try and lower it. Just by coincidence, at the same time, he became aware of the program that we were offering through match day advertising and other forms of advertising. So he took part in the program, eventually losing over the 12 weeks 13.5 kilograms. His waist measurement went down by 19 centimeters, and his BMI was reduced by 5.1. And this is purely through increased exercise. So Alan upped his step rate there. You can see from taking an average of 4,500 steps a day to up to 11,000 steps a day. He told me this as well. Even when it was raining, he would just walk around his house, which I'm sure went down really well with the rest of the family. Alan has sustained his weight loss since taking part in the program, and has now lost, I think at last count, because he's still exercising with us, around about 3 stone since the program has finished as well. So so that was that example is from over a year ago. So Alan's course finished around a couple of weeks into the first lockdown. So Alan's continued to sustain those changes that he made during the course. So that is one example. And the second example is another season ticket holder called Kevin from Middlesbrough. So Kevin was recently retired. He had an active job all through his life, but found that upon retiring, he wasn't exercising, wasn't moving around, wasn't being active enough, and put on a considerable amount of weight. In addition to this, he was told that his blood pressure was too high, and again, he was on the verge of being given medication for that. Upon hearing about the course, again, I think he found out through the match day program. Kevin started the program with us, and then over the course of the 12 weeks, lost around 8.8 kilograms. His waist measurement went down by 22 kilograms, and his BMI dropped by 2.4. Kevin's story was slightly different because halfway through the program, he unfortunately lost his father-in-law and was on the verge of quitting the program. He was convinced by coaches to continue, and subsequently found a benefit of regular physical activity on his mental health. And as he explains, just to quote him here, he says, he went from strength to strength there. He said the messages from the coaches really lit the fire in his belly, and he joined back in, and it was to their testament that he went on to lose his weight and to complete the program. And Kevin is still exercising with us at the moment as well. So again, it's a similar story to Alan. Kevin went from nearly no activity or relatively low activity, then he got 3,400 steps, going up to 10,000 steps by the end of the program. So making those small changes and increasing activity really had a benefit. So that was another example. There you go. I'll leave that as the end of the presentation. And if anyone has any questions later on, that's all right.
Thanks, Paul, and thanks for sharing those really impressive statistics with us and great work. So just in the interest of time, we're going to move straight on to our final presenter for this session. So this is Ashley Lowe from Newcastle United Foundation. Ashley's on it. She's sharing the screen already. Fantastic. And then we'll have a few questions after Ashley's presentation. Over to you, Ashley.
Okay, thank you. So you'll be pleased to hear that I've just got a few slides, and so I'll try and get through it as quick as possible. So I'm here today to talk about the Be a Game Changer campaign. So can we see that second slide? Oh, hold on a second. I'm just going to switch my slides over. Can you see my second slide there? There's always going to be a technology issue. Sorry about that. Right. Okay, I'm just going to talk about the campaign. So basically the Be a Game Changer campaign is a mental health campaign for football fans in the North East. So back in 2018, we received some funding to try and improve mental health in the region. So what we did was we looked at the current information that was out there on national campaigns and local campaigns and spotted some gaps. So we knew that we wanted to use the power of football to reach to men initially in the community, and that was because there was loads of statistics out there about poor mental health. So you'll know that 1 in 4 people has got will experience a mental health problem at some point in their lives, and 75% of suicides are men. So with football having quite a male focused fan base, we thought, right, what can we do to reach out to the males in the city and try and improve their mental health? So that's how Be a Game Changer was born. And rather than just kind of put a campaign out there just that we thought would work, we went and spoke to the fans. So we ran 10 different focus groups, speaking to about 70 different fans, and presented them with our ideas. Now, the whole point of the campaign is to encourage people to talk openly about mental health, but also to take a proactive approach to looking after their well-being and also looking out for their loved ones. We really want the campaign to try to change the culture of mental health conversations, because ultimately that's going to promote positive mental health, it's going to reduce stigmas, and it can actually prevent suicides as well. So the campaign, we go down 2 routes with it. So we've got a population-based approach. So with this, we try and reach as many people as we can with our campaign message. And we do that by using traditional media coverage. So we pitch stories to the local media, and that can be newspapers, it can be online, it is reaching out to radio stations, trying to reach as many people as we can with our message. We also use social media. So obviously we have the foundation's social media channels. Newcastle United would also share our content for us, and that has helped us to reach over 3 million people so far in the campaign's lifespan. We also, 2 seconds, I'm having a little technical issue. I'm trying to get my slide working again. Okay, we also know the importance of case studies. So when we were doing our initial research, we spoke to the fans and we said, you know, what's going to inspire you to open up and share your mental health journey? And one of the big things that came out of it was real life stories. Now, yes, it's inspiring to hear from a footballer. However, a footballer is not relatable, whereas a football fan is. So we've tried to put out as many real life stories as we can that cover a different range of mental health issues. So far we've had about 15 fans that have shared their mental health journey for us, a wide range of issues, and all of these fans have wanted to do it to inspire others to open up and seek help. And it's all about trying to reduce those stigmas. The more people that you see sharing their story that you can relate to, the more it becomes okay to talk about mental health. So we've also done a lot of match day awareness. So hopefully you can see here, we had a massive banner over the seats throughout lockdown. We're really lucky to have that. So millions of people have seen that on the TV. But when we're allowed in the stadium, we give out little business cards to fans, directing them to our website. Now we find business cards are a really good little tool. If you give out leaflets, people are more likely to scrunch them up and chuck them away. But business card, pop it in your pocket, pop it in your wallet, and they can take that home to look at. We've created videos as well. So we've got fans that have shared their mental health journey, which has been really good tool to use, obviously, by sharing online. We have also created a football mindfulness track, which probably sounds a bit a bit odd, but we wanted to make mindfulness kind of palatable for a football fan. So we recorded sounds of St. James's Park when we were allowed in the stadium, and we put that into a 7-minute mindfulness track. So I'm going to share a link in the chat box at the end of my discussion, and you'll be able to access all of this content we've created. We wanted to create as much content as possible for people to share, so there's something for everyone. We've got a Facebook community group that's got 2,500 people in. So people like to sort of share stories in there and inspirational quotes. Liz mentioned how we've got a partnership with the Foundation of Light. So last year, the Foundation of Light came on board and they've got their red and white version of the campaign. So that enables us to reach out further across the region. And then we work closely with fan groups, of which there's quite a lot for Newcastle United. And that means that we can get on podcasts, etc., and get to the heart of the people we're trying to work with. And then I'm just going to quickly touch on our targeted approach. So targeted approach is reaching out into sort of smaller groups. So we work with local businesses. If you are a business here today in the region and you want some of our free resources, please contact me so you can have posters, graphics, we can come and do workshops for you, and all of that is complimentary. We work with grassroots football clubs. We again offer out all of our resources. We'll offer mental health first aid courses as well, mental health and wellbeing workshops, which we're currently delivering online. We've developed a peer support group for over 50s called Football Talks. We have a really popular walking football program with over 200 over 50s that access our sessions each week. And then we've got a 12-week intervention called the 12th Man, which is my colleague Oliver is doing his PhD on the program. So he's designed it around long-term behavior change theories. And we do loads of different wellbeing topics. And at the end of it, the guys have formed friendship groups and have tried loads of different exercises and learned loads of different tips to improve their overall well-being. And then I've just got a little side here. So this is a QR code. If you were to open up your phone, pop your camera on there, it'll take you to our Linktree page. The Linktree takes you to all of the campaign content, so you can see everything that we've created for the Be a Game Changer campaign, but I'll also put the link in the chat box. And that is my whistle stop tour of the Be a Game Changer campaign. Any questions, please do ask. Thank you.
Thanks, Ashley. Was a whistle stop tour, but thank you for getting us nearly back on time. So we can take a couple of questions. So there's a lot of really useful questions and discussions in the chat. So it'd be great if our speakers could have a look through at some point if you get a chance, and maybe just connect with some of the people that are asking questions. I think Oliver Bell's going to help me a bit with the questions, but just to kick off, there was a question from Alison, which is something that that actually came up in a discussion that Oliver and I had with some academics last week about whether the programmes are they just attracting football fans, or are there non-football fans who come and take part in the programmes as well? So I don't know if any of our speakers would like to comment on that. Liz, have you? Thank you.
Yeah, happy to. I think what we're able to do is open the doors for people that perhaps don't want to go and have a conversation with some of the more traditional routes. And that's where, you know, sort of making every contact count and every opportunity to share those messages are so important. There is, a growing amount of research around kind of fandom, and EFL Trust, who, we're very associated with. They have based a lot of their funding and opportunities based on being able to almost use that badge as a hook to bring people into different programs. So some of the people, especially, on Paul's program, those statistics were staggering. We've been delivering the program just for one cycle because of COVID, but a lot of the men said they wouldn't traditionally have gone to a Slimming World or a Weight Watchers. It just wouldn't have crossed their mind, but because it's done in a way that is using the power of the badge and that association with, it really does sort of touch people's hearts and minds. And you don't have to be a fan to engage. I think it's, for some people, they're not season ticket holders, or they might watch a bit of, and it could be a red and white, a black and white, or a red. It doesn't really matter. It's just about that universal language of football. But I don't know if any of the others have any other experiences. But for us, we're open to all.
Yeah, if I can just jump in here, Liz, if that's okay. So obviously I used to work at Sunderland, and obviously I'm at Middlesbrough now, and see Liz booing there in the background. And from a football fan perspective, I think it does sort of cross fan bases across different sports. And I don't think you have to be a huge football fan to be engaged by it. I think the badge is a very prestigious badge. And I think particularly maybe in deprived communities, so when I've been to network events across the country, particularly maybe in the northeast, maybe Blackpool, certain areas where there's a lot of deprivation, and the club is seen as this beacon of hope for a lot of people, and it's something that's really prestigious that they want to be proud of and be associated with. So even if you're not a football fan, and you would want to go home and tell your family, wow, I'm working, or I'm getting connected to Middlesbrough Football Club or Newcastle United Football Club, because there's a sense of prestigiousness about it. Obviously, if you're a football fan, there's a natural, stronger hook to it. But I wouldn't say you have to be a football fan. I think it goes deeper than that in our communities.
Great, thank you. Oliver, have you got any questions there?
Yeah, we had a few more in the chat box. So there was an interesting one around how we're measuring well-being and quality of life, and if there is any interest in subjective measures such as outcome measures or any other tools, children or adults. So I suppose it's around how do we measure the effects that we're having with the people that we work with. So I don't know if, again, any of my colleagues who work for foundations could add any sort of insight around how we're collecting some of the valuable work that we're having within the communities we're working in.
Sorry, Liz.
After you, John.
I mean, from our side, I think out of probably the three foundations, we're probably the bottom of the league connected to the data impact. We've actually just employed somebody, I think, across foundations up and down the country. I think it's probably the Achilles heel of a lot of foundations, where we've got this great unique selling point of engaging with individuals across the community and having that ability to inspire people. We've got really enthusiastic staff, fairly highly qualified, but it's just selling that story and making sure that we sort of can demonstrate it and it's validated. I think from a funding perspective, obviously 90% of our programs will be funded by a certain body, and sometimes that evaluation will be pre-prescribed by those guys. So if we draw down funding for Paul, for Fit Fans, whoever's funding that program potentially will give us some questionnaires, or if it's qualitative or quantitative, of how they want that information collected. So it's probably different from program to program. We're currently trying to look at that to make sure that it all fits into one stream. And as a foundation, everything that's health related is measuring in a certain angle. But it's something that we're conscious about, that we're measuring the right things, and things are validated. So if we are writing funding bids, the evidence is strong that we're collecting. I don't know if you feel the same, Liz, or you've got something I can steal off you.
Absolutely, John. Happy to share whatever we have. But we've had a good hard look at this over sort of the last couple of months, and we're just working with an external organisation to help us with impact, because again, I think for a lot of the programs, people have developed their own mechanisms for developing or saying what impact has actually happened. So I do think, as you know, sort of as delivery, we need to be much better at sort of recognising, like John says, the validity and the, you know, the statistics that make it useful. Again, I'm not an academic, so it's a long time since I was at university, but I think, you know, what we want to be able to say is that, you know, that we are making a difference, and it's not anecdotal, you know. It's so whether that's measuring and supporting people with baselines, and then sort of 6 months or, you know, into a program, 12 months into a program, 6 weeks after a program, whatever it might be. But it's having that confidence that we're doing it consistently, and it isn't, you know, just down to a member of staff being particularly supportive of M&E. But I think that's probably a massive area of opportunity and collaboration, if I'm being perfectly honest. And I think that's where Andrew, who's our PhD student working with us, you know, is we're hoping to, you know, to get some of that from him. But I say, just be consistent. Whether if we say we're measuring self-esteem, which measure are we using, and are we is it appropriate? Yeah.
Yeah, I was going to say, Liz, that's a, you know, really, really good example of what could come out of today in terms of collaborations with academics, because they should be able to have those conversations, and that might come up now in the breakout rooms about, you know, how what different measures can be used, or ways to evaluate programs and things. So hopefully some of that will come out now in the breakout rooms. I don't know if Andy Smith still with us? Just a quick question. Hi, Andy. I guess just maybe from your perspective, having worked with Everton for a long time now. I mean, just, I guess, any bits of advice that you could give to fellow academics on the call who may be thinking about opportunities to work with foundations or CCOs, but about what's the best sort of way to develop and go about those collaborations?
Yeah, thanks, Emma. It's a regular question. And even though it's a regular question, I'm surprised that we don't ask it more as academics and as university institutions. I think that we as lots of academic institutions, that they don't always work in collaboration with the charitable foundations of the clubs, preferring instead to focus perhaps on some of the more glamorous sides of sport and working with the professional football academies, talent ID, finding the next person who's going to play in the first team and so on. And whilst there's a space for that, particularly in relation to sports science, I think for us working in the public health space in particular, or in community sport spaces, there's a real opportunity here for us to think differently about how we engage with research users and how we develop those collaborations with networks. Certainly from our perspective, it started very much from a general conversation about student volunteering and placements and kind of really, as many of these things do, but really then it developed into a much more strategic discussion around how we can provide some of the expertise that colleagues have just referred to around monitoring and evaluation, and about access to resource and insight. And we can do that pretty well in HE, and we've got those resources to help people to do that. Whereas many of you guys who are on the front line, who know your communities best, you know how to engage them. You don't have necessarily that particular expertise or skill set all the time. Some do. And instead of trying to replicate or to compete, what we try to do is to leverage that mutual support and expertise locally, and to accept what some of us are so-called more experts at than others, and to share that resource. And I think having the same philosophy and values is really important. What we try not to do is to treat Everton and colleagues like a babysitting service. Because universities, we know we have to get students good applied work experience. There's a real temptation to flood these guys with lots of students who want volunteering experience, but actually if those aren't appropriately supported, if they're not the right type of caliber of people that you're looking for, it actually turns a lot of the other guys off because they have to do all the work themselves. So it's important that I think you establish the key criteria for working at the beginning, but also to have that regular conversation. And universities, as you'll know, increasingly we're judged on obviously the impact of our work, rightly or wrongly, in different ways. And there are real opportunities, I think, to think seriously about what that looks like, and to develop those local collaborations, and to hit three things really: research, the student experience, and also, when appropriate, funding. And we've tried to think of all of those things in the same breath really, and to support the work of the charitable foundations, and in our case, obviously Everton, to achieve their particular target. So I think we're well placed as a sector to help support local communities. It's part of our job to return to the local economy and the local communities what we do. And certainly from our experience in the Northwest, many of our students are local students, so they generally come to us and they return to work in the Northwest. So actually part of that economic and strategy and supporting the community well-being is really about employment as well. So you can kind of join those things up. And that's really for us has been one of the key benefits, I think, from both parties' perspective.
Thanks, Andy. That's really insightful. So I'm conscious about time. What I think we should do is the plan is to go into breakout rooms now. I say there are still some comments and questions in the chat, so perhaps in the break, if speakers could maybe have a look and respond to any questions that might have been relevant to them. But we're going to go into the breakout rooms now. So the plan was to have around 20 minutes sort of as a consultation session, so sort of led by the representatives from Newcastle, Middlesbrough and Sunderland. So I'd say still do that session maybe for about 15 minutes. There'll be a fuse lead in each of the breakout sessions as well. they can kind of maybe try and work out the timings for the groups, but if you can still have about 15 minutes or so on those consultation sessions, so it's an opportunity really for the foundation reps to discuss some of their ideas, what directions they might be looking at within their communities. Have a bit of a break, but stay in your breakout rooms, don't leave them. And then the second bit is about some research action planning, but what I'd suggest is maybe take a little bit less time on that bit so that we've still got time at the end of the day to feed back. So we'll still come back together as a whole group at 4:15 so that there is time to feed back everybody's thoughts. So go into your breakout rooms, don't leave them until 4:15 when you'll come back into the main sessions. Okay, back into the main room. So I hope you've had some good discussions. I know we certainly have in our breakout room. So for the last 15 minutes or so, I'm just going to ask a representative from each of the 3 breakout rooms to feed back just some of the key points of the discussions. We've already probably got 5 minutes per breakout room, but just be useful to have a summary from each group as to what the sort of main points of the discussions were. So Dave Archer, are you? Yeah, brilliant. I'll pass to you first then. Thank you.
Yeah, we did a lengthy discussion, which are really useful things came up there. So we had our 4 questions to look at, and one of them was to look at which groups we were thinking about. And one of the first ones suggested was the older age population, and often that can go alongside disability. And we thought that there was issues like obesity and mobility issues that were present in those populations. And linked with that, we looked at those who are released into self-management. So those who've gone through, say, cardiac screening and cardiac rehabilitation, but then they're released into managing it themselves. And we thought the foundations and football could be really valuable to get those people, to enable them to access an environment where they could get necessary physical activity, but just as importantly, that social and interaction with others and the value of that in terms of issues like loneliness and social isolation. Another group we thought that could be affected are deprivation, so the impacts of food insecurity and social isolation in some of the more deprived environments. And some of the issues that are linked with that are that social isolation can be digital exclusion. So we were chatting about some things that Sunderland did, the Foundation Light did, such as providing dongles and tablets to people in the community to enable them to engage with some of these sort of digital initiatives and sessions like that. We also covered, we had people from Carlisle, for instance, and Cumbria. So we covered the issue of geographical isolation. So how do you manage, if you're based in Sunderland, say, people in a small village in County Durham, or if you're in Carlisle, how do you support people in Barrow and Furness? So we thought that was a group that could be isolated. And some of the roles we thought would be valuable for reducing that isolation is a sort of a hub and spokes model in terms of not just being based on big clubs. So obviously big clubs and foundations have the resources and the expertise and the experience, but if there was a way for them to support local clubs, community clubs, to run in partnership with them on a local level, that could deal with some of those issues of geographical isolation and possibly even deprivation, depending on the areas as well. An interesting group as well, was particularly with COVID, is people waiting to be treated for long-term conditions. And the support we could do there is in supporting people to wait well. So we know that outcomes from surgery and various different things are related to physical fitness. So ways to support people while they're waiting for those treatments, we thought would be beneficial. One big message about in terms of engaging marginalised communities was not having a one-size-fits-all approach. So Liz was talking about that personalised approach, which does take more time. And some of the things they have running are that step down program for people coming off cardiac rehabilitation and pulmonary rehabilitation, the extra time hubs they're providing. So that personalized approach will make it more effective. And finally, we sort of thought that overall things that made programs effective were being connected in the right way. So having those connections, whether it's with the NHS, whether it's community organizations, third sector, local clubs, local schools, that were a way to really adopt that personalized approach and spread the impact wider than just around the club itself. So yeah, that was a summary of our discussions.
Great, many thanks, Dave. That's fantastic. So I think Nicola is feeding back from a breakout room.
Yeah. See if I can share my screen as well. So yeah, we looked at the 4 questions, and we just basically had a chat, and I tried to arrange these under different headings, so I apologise if I put things in the wrong place. But in terms of the first question about the health issues and gaps that we've noticed at the minute, thinking particularly ethnic minority groups because of the COVID situation. So like thinking really in terms of current issues, that might be an area that we want to explore going forward from here. And then also mental health is a big issue again because of COVID, but I think even before COVID, it was becoming on people's radar a lot more. And we were talking about things like that and how do children come to experience mental health difficulties? How do anyone come to experience mental health difficulties? Because if you understand the background behind that, then you can work out how to effectively address it. So they were our first 2 answers to that first question. In terms of what support, it comes down to the fact that we think that there's a gap in knowledge there. So we don't know the extent of the needs of some of those target populations. So we're then thinking that's how the foundations and the universities can come together and interview people to find out, well, what are their needs? Why have you engaged? Why have you not engaged? And then we can offer better support. So that's kind of tying in with that first question, what are the gaps at the minute? And trying to offer something that's sustainable as well was an issue that came up. How can the health programs engage marginalised communities? So we said having a system-wide approach. The triage system at Everton seemed to work really well, assessing everybody's individual needs and what can we do to help that particular person. And you can also use that process as a way of answering that problem that we had in part 2. Not only are you looking at how we can deliver the right things to the right people, you can then work out how do we reach others that are similar. So we thought that was a direction for that. There was a suggestion for child and adult programs to be run, because then we can potentially reach parents by doing an intervention that is for both the child and the parent, and then you advertise through the school, and then the parent becomes involved in that way. So that's a way of reaching just beyond the school setting. And partnerships with organisations like the NSPCC. So the foundations contacting those other organisations that have got those insights into groups. This was particularly in relation to that mental health one, and bringing those groups together then better informs that intervention. So that's how we can help engage people through that expertise. And then the last one, how can health programs be truly inclusive? We've got, we tend to, when researchers reach out to members of the community to find out what they want from an intervention, you're always going to get an unrepresentative sample. So maybe by working with the foundations, we've got then a sample that we can dip into to better inform our programs. Consider what's in it for the participants. So that's why the foundations quite often offer tours of the stadiums and things like that. So it's what are the participants getting out of it? Then that'll attract people. And really importantly, I thought that was a really good point. Celebrate that programs are inclusive. So when you get your results, show that inclusivity, because that keeps that awareness going, that this is an important issue and something that we want to continue to address.
Great, thank you, Nicolette. And then the last group, I think, is Scott. Scott apparently went off piece and didn't go with the questions, but I'm sure still had an interesting discussion. So Scott, your turn.
Yeah, thank you, Emma. Yes, the Fuse, the organising group, which I'm part of, are going to shoot me afterwards because I completely forgot the 4 questions, which, hey, whatever, but we still had a lively discussion. So one thing which we discussed was how do we genderize delivery where appropriate? So where are sessions female only, male only, mixed? You know, so that's where appropriate. Andy was making the interesting point about a program which they'd run down in Liverpool around with Everton. Needs to be careful there with my terminology. Around veterans and how that's been advertised very neutrally, but to date it's only recruited male veterans when we know that there are female veterans out there and there's definite health need. We had a discussion about what is it that attracts people to the badges of the football club, particularly what differences might there be between the people who are actually fans of the club, people who might be fans of another club, or people might not be interested in football at all. Paul from Middlesbrough Football Club Foundation was saying that certainly lately he's seeing more non-fans of the borough coming through, football fans in training, for example. We had a discussion about how we ensure, and this goes across all kind of public health individual programs, is about how do we maintain that behaviour, that habit transfer past the usual kind of magic 12-week window, which a lot of our programs are based on for no particular good reason. We just seem to stick to that kind of 8 to 12-week window for our programs. There was discussion building on something that Liz said earlier, I think, around everyone making every contact count and embedding that across the clubs. Personally, I raised the issue about social prescribing. I think there's a huge opportunity around social prescribing. You know, every primary care network across the northeast, well, across the country actually now, has got these armies of social prescribers. And how are we in general linking in with those and making sure that those social prescribers are aware of the opportunities that are available to them prescribe to their clients. And I think we came back to, and this was a point by Andy, about coming back to that focus that we always have from a public health perspective about focusing on inequalities and just always keeping that in mind. So yeah, I went off piece, but hey, that's me.
Still some really interesting discussions though, and really valid points there, Scott. Thank you. So we've got a minute left. I just want to take that time to say thank you very much to all the speakers for sharing their experiences, and to everybody for their contributions to the discussions today. It's been really, really interesting, really fascinating to hear all the discussions. And I know that the recording will be circulated to everybody, so you will have access to that to be able to go back and have a look at particularly the notes that have been made from the discussion groups there. So thanks to everybody for their involvement. I hope there is some follow-up from this. I know that the Fuse group, I think, are going to reconvene in the next couple of days and maybe think about the best ways to follow up. I'm sure some of you have got email addresses and individuals that you want to follow up with, but there may be a bit more of a bigger follow-up afterwards.